Born and raised in New Orleans, so went to high school at Mount Carmel Academy, proud alum of Mount Carmel, and then went a little bit north for undergrad at LSU in Baton Rouge, studied science there, got my bachelor in science, and then moved a little bit further north for medical school, went to LSU in Shreveport for medical school, and loved it so much up here and stayed for residency and did my ophthalmology residency here. First and foremost, growing up, my grandmother was diagnosed with wet macular degeneration, and so as a child, I kind of was with her through the progression of her slowly losing her vision, and I think, it was very difficult to watch her kind of lose her independence because of, losing her vision, and I always told her growing up, wow, I wish I could just give you my eyes for a day or two, just so you can enjoy the things that you used to enjoy. So I think when I went into medical school and went into training and kind of found ophthalmology, I realized that would kind of provide me that, that benefit of giving that back to someone else, whether, I couldn't do it for my grandmother, but maybe I could provide vision and give someone else that second chance. One of my mentors throughout my training always coined the term 20 happy. So, on the eye chart, we always strive for 20/20, 20/25 vision. However, he always stressed the importance of, 20 happy. It's not about how far they can get down on the eye chart. It's just making sure that your patient is happy and comfortable with their vision. So for me, I think that's something I plan to carry out through my practice, just making sure, we work hard to get my patients comfortable and 20 happy. The people and the patients, I really, that's the main part of this career that I enjoy the most, is getting to know a patient and being able to walk them through, whether it be, their day-to-day exams versus something like a difficult time in their life. I really enjoy getting to get to know them personally and seeing them throughout the years and forming that relationship with patients. Anyone that has a really dense cataract to the point where it's limiting their vision, it's limiting their life, they don't feel like they're able to do their daily activities and they're not comfortable living the way they're normally used to living. And then for cataract surgery, one of the reasons I picked ophthalmology is that, cataract surgery can sometimes be almost immediate gratification for patients. So, after that surgery, they come in the day later or 2 days later and they suddenly, they're able to regain their independence again and just feel like, I've given them back so much of what they had lost. The gratitude that, that they show me is really something that always sticks with me. It's the reason I went into the field and really just, enjoy that part of the job.